Hi, this is Dr. Carrie Kramer-Webb, and today's video is about sacroiliac joint dysfunction. This is very common in the running community. Let me show you what it is. So I've got my trusty spine model today, and we've got the spine and the pelvis. And what we're specifically looking at is the sacroiliac joint. That is where the spine comes down and it meets the pelvis. So you've got two sacroiliac joints on either side. What this is going to feel like is a pinpoint pain in that area, especially when you're landing on that leg during the run. So what happens is the pelvis can become a little bit unstable. You know, a lot of times you'll hear this SI joint goes out. It doesn't go out, it doesn't dislocate. This is not a scary situation. It's just something that needs to be stabilized. So we'll also see it too in runners that have said they've been diagnosed with groin pain. So this is a really sharp pain right in the groin. And what it is, it's the same thing where the pelvis is a little off, but it presents with a sharp pain in the pubic bone area. So if you think about it, you'll never have a groin strain as a runner because you're not going side to side unless you're hurdling or something like that. But if you're just straight up running on the roads, the pelvis can shift and then create a little friction in the front. The reason it happens, so the why behind the sacroiliac joint, is because when you're running, this is unstable here. So the pelvis should only move side to side 5 degrees when you run. This is going to be a runner with excessive hip movement, and so you'll get some shear in the sacroiliac joints or potentially in the osteitis pubis in the front. And it has to do with weak gluteus medius and adductors. So picture muscles on either side here that work to control this plane of motion. That's where we get into trouble and present with sacroiliac joint dysfunction.
Okay, Michelle is here to demonstrate how to test your strength around your hips to see if you're stable with a sacroiliac joint dysfunction. So the first test, these are taken from the Bunky's test, and the first one, you're going to put your foot and ankle up onto a bench or a chair, lift up into a side plank position, lift the top leg, and you should be able to hold this for 45 seconds on both sides. You're going to test the inside part of your thigh, called the adductors. Same position, ankle on the bench or the chair, lifting the bottom leg up and holding this position in a side plank. The goal is 30 seconds. If you do fail this test, the way that you can fix it is to use these test positions as a strengthening exercise. So you can use that same test position and choose to hold it for the time goal, or you can start by lifting your leg up and down, making it a little more dynamic. Start with 3 sets of 10 and work your way to 3 sets of 20 on each side. That's for the gluteus medius and obliques. You can flip it to the adductors and do the same thing.
One of the most common run dysfunctions that leads to sacroiliac joint dysfunction is an asymmetric landing between the right and the left leg. So if one is hitting harder, the pelvis will tend to get a little bit shifty. So what you're going to do for this is head to the treadmill or outside. All you're going to do is listen to your foot strikes. They need to sound symmetrical and soft. And there's also a whole bunch of wearables and apps now that can actually tell you how much impact you're landing on the right versus left, and you want that to legitimately match 50-50.